Hi, I'm Dr. Knies at Rose Injectables. I'm the on-site physician and founder, and also am the one who came up with the Perky Peach. So let's talk about the Perky Peach and why it has become so popular over the years. Well, back in the day, after I was done having children, I experienced what most women do, and that was some weakening of the pelvic floor muscles. So what happened with me is I went to jump on a trampoline and realized there was leaking. I also experienced having to think about where the bathroom was all the time. Costco or Sam's Club was the worst because the bathrooms are always in the back, and I would have a commute to get there. And by the time I got there, I could just never feel like I could get to the bathroom in time. And the last thing that finally did it for me was one night I was working a night shift in the hospital, and driving there to get to the night shift, everything was closed, and I really needed to go to the bathroom because I was trying to work out and be fit and drink water, and it worked against me. And I ended up having to use the restroom on the side of the road. And I thought, why isn't there a better option for women? Here I am as a physician, a professional. I know what's out there. And unfortunately, the options just were not good ones for me. The options that I really had access to would be medications, which do come with significant side effects, and surgery. So like a bladder sling or lift option. Well, I had young children. I knew the surgeries have complications. There's mesh, there's other things that happen, and a lot of them can fail. And so knowing that I would have to take time off work, by the time I paid my deductible for my insurance, was off work and probably had to pay for somebody to help me lift my children, then I was going to be paying way more than if maybe I could find another option. So I went on a hunt to find the treatment that could help with so many of the things I was experiencing, but never heard anybody talking about, even when I went to my own OBGYN's office. So on my look for the best women's health pelvic floor treatment, I found Perky Peach. So Perky Peach is a painless treatment that we usually do as a series of 3 about a month apart that is intended to strengthen the pelvic floor muscles, create this lift, and invigorate that vaginal tissue, help it with dryness and other things that the majority of women are experiencing as we're aging. But the coolest part is there's no pain, there's no downtime, it's not so scary, but it's unknown. And so that's where I see women hesitate because they know they want to get help, but they're just not sure what it's going to be like and if it's going to be really awkward or what to expect. The other thing is they're trying to understand. A lot of times women are like, okay, I've got some leaking incontinence. I can't sneeze or cough without leaking, but why would an intravaginal treatment help me? And I'll tell you it's because with the energy that can be applied to the tissue actually can go deeper than what you can see, and it's able to create change to the muscles of the pelvic floor. So it's an amazing way to treat incontinence symptoms, and even women who've had quite a few other things going on, like recurrent urinary tract infections. Sometimes we have to strengthen the muscle around the urethra so the bacteria can't ascend as easily and create those infections. Let's talk about the process for the treatment, when you're coming in, and what to expect. Okay, so the process is you come to the office, you're going to have a questionnaire. We're going to go over your history, what's going on, and I want to know all the details. I want to know if you wear 5 Supermax pads a day from leaking urine through the course of time. I want to know what specific activities in the last few weeks have brought on leaking or other symptoms. I want to know what your dryness is like. I want to know if you're on hormones and if that's helped with some of your symptoms as well. All these things, how many UTIs you have. We want to know all of this and quantify it because as we go through a series of treatments and when you come in, I want to have that conversation with you to know how are things going. There are different treatment options along the Perky Peach spectrum. There are sometimes I may suggest that we change a little bit along the way because you could have a mixed incontinence or you could have a predominant urge incontinence versus stress incontinence, and there may be an option that could work just a little bit better for you. So I like to make sure that we've got all those details spelled out so that we have a plan for you and a check-in process as well. So you come in. This is what we use for the standard regular Perky Peach. This is pretty much what we start every patient on when they come in. So nothing crazy, nothing scary. It is not a very large device. It's smaller than a transvaginal ultrasound probe. And the magic is here in the end. It's bipolar radio frequency. So it's grounded to itself and it's extremely safe. It checks the temperature over 1,000 times per second so that we can keep you at that maximal temperature that creates cellular change and builds collagen, improves the cell health, and strengthens and bulks the muscle, all these different things just from this area. The first part of the treatment is 10 minutes internal. We will use the device, we'll go into where the cervix is or where it would be if you've had a hysterectomy or anything like that. And we will do the treatment internally for 10 minutes. You'll feel pressure, and you should, because I want to direct this energy to the pelvic floor muscles so that we can create that hypertrophy and change and get that lift for you that you're needing to stop some of the symptoms that you can be experiencing. Okay, that's the process, 10 minutes internal. External then, after we do it 10 minutes external. And those are the amazing before and after pictures you see. Since I can't photograph internally, what I can do is show you externally what it looks like. And so you can see in a immediately before and after a treatment, the skin's tightening, the wrinkles are going away, things are all lifting. So these changes happen very quickly, and you can notice immediate results with the treatments. And sometimes they're situational. We have to wait until you cough or sneeze or jump on a trampoline to know if it's worked or not. One thing about the mechanism, sometimes after kids, we feel like the tissues just isn't the same. And how I explain it is when you first have a balloon that hasn't been inflated, it has a certain tightness and texture to it, right? But once you've inflated it and you let the air out, so having a baby and letting it out, it doesn't ever go back to that same size. But if we apply energy to the tissue, we can contract it down better. So it's not to say that the only women I treat are ones who have had children. Quite the contrary. I have a lot of women who just with aging experience these changes to the pelvic floor muscles and to the tissue, and we can still treat them all effectively. For preparation for the treatment ahead of time, I do ask that you shave on the outside, because what we want to do is make really good contact with this bipolar radio frequency externally. We will use ultrasound gel internally and externally. This doesn't require numbing. Like I said, there's no pain, there's no downtime, but this will heat the tissue, and that heated tissue does stick around for 24 to 48 hours. So while I don't give you a limitation on intercourse or pelvic rest, I do usually recommend that if you can wait a day or two, that's great, but it's not a requirement to use and have the treatment done. Important things that I need to know that are going to be imperative for preparing for your treatment. I want to know your last pelvic exam. I want to know if you've had an abnormal pap smear and what the results of that were. I want to know if you're having bleeding. We usually do not schedule the treatments if you're on your cycle. And so sometimes it happens and we just have to reschedule, and that's okay. I need to know if you're interested in laser hair removal in the area, because it's a great time to do them both at the same time, to do bikini and Brazilian or whatever you're interested in, because it's a really quick way to do that. And if you want to add it on, that's no problem at all. And we also offer a discount usually if people are doing it that way. I want to know about any medications that you're on, any issues in the area or pain that you've had. And if you have a history of any trauma or anything like that, tell me. I have women, hundreds of women that we've treated. I've got patients that come from 15 states and over 3 countries, and everybody has different backgrounds. And so we want to be sensitive to that, because if you identify this as something that you think you need, then it's my goal to get you through this as comfortably as possible. And so letting me know those things is great if you can. If you do have a history of cold sores or herpes lesions, I do want to know that. Sometimes adding heat to an area can actually create an outbreak. And so we can have a prescription for you ahead of time that you can start the day before your treatment so that we can avoid this happening. Same sort of thing for laser hair removal. We would want to know that as well too. So how long does the treatment last? And about doing the treatment, how long does it take? So like I said, the full treatment in the office each time is about 20 minutes, 10 minutes internal, 10 minutes external. And then how long the treatments last, I have plenty of patients who have had these treatments last them for years. But it is wise to kind of think about planning for a maintenance treatment, maybe once a year, depending on what you have going on. Everybody's tissue is going to be different, and I deal with so many different ages of women in my office. My youngest being in her 20s that's experiencing symptoms of incontinence or dryness or just loose tissue that she's wanting to tighten down again. And then I have patients that are in their 90s that are wanting to treat and improve their lifestyle and quality of life where they're not always thinking about the bathroom. So keep that in mind. Everybody's going to be a little bit different. So I don't have an answer that clearly covers every single person, but it's not a bad rule of thumb to think about doing your initial series and then planning to do maybe one a year. I am so excited about your interest in the Perky Peach, or that you've signed up to come in and have the treatment done. If you have additional questions about the preparation for the treatment before you come in, please reach out to us. We want to make sure we have your questions answered before we get started. And just know it's going to be a little bit strange the first time. You're wondering what's going on. We've we've all been there. I was there too, getting my first treatment done. But just know that you're in the best hands. We do more of these treatments with Perky Peach than anybody in the United States. And we train other providers on doing this and making it the most comfortable, seamless procedure out there for women, because to me, it is a really big deal that you feel comfortable, that you feel heard, and that we can easily take you through and carefully take you through sensitive treatments so that you feel like you can regain your quality of life. Because I think women deserve to get these things treated, and that we have amazing options out there that, even though we don't take insurance in our office, are oftentimes still cheaper than using your own health insurance because of deductibles, downtime expenses, complications, incisions, all these different things. And so many of our treatments at our office just don't come with those bigger price tags or downtime and other things like that surgery does involve. So that's where we sit. We're sort of between a med spa and a plastic surgery office, and we look for niche, novel treatments for women that are life-changing, but many have never heard of. And so we're just the squeaky wheel passing the word around to make sure more women get help for their symptoms so they can live the best quality of life that they're looking for. So just know you are in the best hands, and we cannot wait to take care of you.